In this lesson, we'll be covering infections of the nervous system. So to take a basic overall look at the nervous system can be divided into two parts: the central nervous system, which consists of the brain and spinal cord, and then the peripheral nervous system, which basically contains all the nerves that emanate off of the brain and spinal cord throughout the rest of the body. The nervous system collectively has three important functions: sensory, integrative, and motor. So the sensory portion is fulfilled by sensory receptors that run throughout the peripheral nervous system. They are obviously going to send impulses back to the central nervous system, being the brain and spinal cord. Within the central nervous system, specifically the brain, those sensory impulses are integrated into thought, and eventually new impulses are sent out to motor neurons throughout the body for the final motor function, which is going to regulate muscular movement. So within the nervous system, we do have various immune properties that help prevent infections. One of the most popular barriers being the blood-brain barrier. So the blood-brain barrier has to do with the blood vessels that run throughout the brain tissue. Obviously, we have blood vessels that run throughout every tissue or organ in our body, lungs, kidneys, liver, whatever it be. And for the most part, if something is in the blood, like an infectious pathogen, it is very easy for it to diapedese or leave a blood vessel and then enter a tissue such as the liver, kidneys, lungs. However, the blood vessels that are found in the brain have very tight junctions as far as the endothelial cells, which make it very difficult for something to diapedese from a blood vessel in the within the brain tissue into the actual brain tissue. So that difficulty is known as the blood-brain barrier. So basically, if something does, like an infectious pathogen, would get into the blood and then go towards a blood vessel within the brain, it is really relatively difficult for it to escape the blood vessel and then infect the brain tissue. Not impossible. If it was impossible, then we wouldn't have anything to talk about in this lesson. There obviously are some microorganisms that are able to get through the blood-brain barrier and then ultimately infect brain tissue, but a large portion of microorganisms lack the ability to get through the blood-brain barrier. So even if they do cause an infection in the blood, they wouldn't be able to necessarily enter the brain tissue and cause an infection there. So one really good thing about the blood-brain barrier is that obviously it can block infectious pathogens from entering the brain tissue via the blood. One downside of this, though, is that it can also stop some medications. So for example, there are antibiotics that are unfortunately not able to pass through the blood-brain barrier. So if someone does have for instance, an infection in the brain tissue, maybe something like meningitis, which is inflammation of the meninges, not only do you have to prescribe them the right antibiotic to target the bacteria, but you also have to make sure you choose an appropriate antibiotic that's able to get through the blood-brain barrier. Because if you choose one that cannot make it through the blood-brain barrier, that antibiotic's not going to be able to enter the brain tissue from the blood, and ultimately it's not going to be able to cure the infection. So there are some good and bad aspects of the blood-brain barrier. So our immune system within the nervous system is what we say immunologically privileged. Basically, that means we have a reduced immune response in our nervous system. Within our nervous system, the brain, spinal cord, those are areas of our body that cannot withstand excessive inflammation. Because what happens with inflammation, it could potentially lead to temporary loss of function. So if you get a cut on your finger and your finger becomes inflamed and you can't move it for a few days, ultimately that's no big deal. You can still survive and make it through that. But if your brain becomes substantially inflamed to the point where it's not functioning and you're not able to seek medical treatment, that could be fatal. So within our nervous system, we have reduced immune responses in those specific areas because we're trying to prevent excessive inflammation, as inflammation within the nervous system tissue often can be quite dangerous, potentially even fatal. And that's one of the reasons why the blood-brain barrier is so important. The whole intention is to block things from getting in the nervous system tissue in the first place. Because if something does get in the nervous system tissue, we have to understand that we don't have as strong of an immune response within the nervous system as we would in other areas of our body. Again, and the whole point of that is to kind of reduce the amount of inflammation that would happen in areas such as the brain and spinal cord. Now, we do have a reduced immune response. That's not to say we don't have an immune response. We do have an immune response there. It's just not as active as what we would see in other areas. So these are just a few different types of cells that are active within the nervous system that are going to help fight infections. The first being microglial cells. Microglial cells are very beneficial towards bacterial infections within the nervous system tissue. Microglial cells are phagocytic cells, much like neutrophils, monocytes. They are able to engulf and destroy bacteria, so they have phagocytic capabilities, but they are exclusive to the brain tissue, so you won't find them anywhere else in your body. We also have T cells within the nervous system, things like cytotoxic T cells that can destroy virus-infected cells, even things like helper T cells, which can help activate the rest of the immune system in order to fight off an infection. So we do have an immune response, it's just not as abundant as what we would expect in other areas. Normal biota, there just isn't any. So there's no such thing as a good microorganism in the nervous system. We have beneficial microorganisms over a large part of our body, but the nervous system is not one of those areas. The nervous system is completely closed off from the external environment, so it should be kept sterile at all times. If you have a microorganism within the brain, spinal cord, whatever it be, it is recognized as foreign and your body is going to be actively trying to eliminate it. So we do not have any beneficial microbes in the nervous system. That area is to be kept completely sterile. So our first infectious disease is meningitis. Meningitis is a generic term that basically just means inflammation of the meninges. And if you remember from previous courses, the meninges are a series of 3 membranous layers that lie just beneath the skull. They basically serve to cover and protect the brain. Unfortunately, microorganisms like viruses, bacteria, fungi, they can get into the meninges and induce inflammation. And when that happens, a patient will develop a case of meningitis. There's a lot of different causative agents, different types of bacteria, fungi, and viruses. All the microorganism really needs to be able to do is get through the blood-brain barrier. Once it gets through the blood-brain barrier and into the meninges, it's going to cause an infection because that area is meant to be sterile. And that's going to lead to inflammation of the meninges, which is ultimately going to create a case of meningitis. So regardless of what the causative agent is, virus, bacteria, fungi, the signs and symptoms of meningitis are fairly standard, and I've bolded the ones that are important for test purposes. So one of the predominant symptoms would be a headache. Obviously, inflammation is going to put pressure on pain receptors, so patients would likely be experiencing a very painful headache. They would also be experiencing a painful and stiff neck for the same reason. Yes, they would have a fever, but that's going to happen with most infectious diseases. Likely they would be nauseous and potentially even vomiting. That's usually a result of the amount of pain that they're in. They would be photophobic, which means they would have a sensitivity to light. And in some cases of meningitis, they would have a skin rash. Not all. Typically with viral meningitis, you would not have a skin rash. However, with certain types of bacterial meningitis, typically there would be a skin rash, and we're going to look at that in a second. So most often the skin rash is an indication that you may in fact have bacterial meningitis, not viral meningitis. You would likely have an increased number of lymphocytes in the cerebral spinal fluid. By lymphocytes, I mean things like T cells and B cells, as your body's trying to fight off the infection. And it can progress to shock, cardiac failure, coma, and eventually even death, although that's typically only going to happen in cases of bacterial meningitis. Bacterial meningitis is much more severe than viral meningitis. Viral meningitis is self-limiting. You make a full recovery just at home, undergoing bed rest. But with bacterial meningitis, it is fairly aggressive and needs to be treated right away with antibiotics. So if you weren't to get it treated right away, that's an instance where it could lead to these complications. So I do want you to understand just the kind of general rule with meningitis, that bacterial meningitis is much more virulent, it's much more severe than viral meningitis. There are a variety of different bacteria that can cause bacterial meningitis. We're going to go over the most common and most serious one, but a general rule is that all types of bacterial meningitis are typically much more dangerous than viral meningitis. With bacterial meningitis, the bacteria are able to release toxins, and those toxins can get into the blood, and they can create a lot of complications. They can put a patient into sepsis, which would cause their blood pressure to drop, and then they'd no longer be getting enough oxygenated blood to organs and tissues, which can cause coma and eventually death. Those same toxins can cause blood vessels to hemorrhage, which could potentially lead to organ failure or even amputation. So it is typically a much more serious condition, and it does need to be treated aggressively right away, typically with intravenous antibiotics. It's kind of the opposite with viral. With viral meningitis, you still get the kind of same signs and symptoms as far as like headache, stiff neck, sensitivity to light, but it doesn't have the same type of impact on the blood, and it typically is self-limiting. So these patients, while they feel miserable, they really don't need outside medical attention. They would just get bed rest at home and typically make a full recovery within a week or so. So it is not in need of dire medical attention, such as what we would expect for bacterial meningitis. So, like I said, there's a lot of bacteria that can cause bacterial meningitis, but the most common and certainly the most dangerous is this bacteria, Neisseria meningitidis. So Neisseria meningitidis causes the most serious form of bacterial meningitis. Unfortunately, this bacteria belongs naturally in certain individuals' nose and throat, which we call the nasopharynx. So some individuals are just natural carriers for this bacteria. So if you were in close contact with them for an extended period of time, you could potentially acquire this bacteria from them, because when they cough, sneeze, or speak, they would be releasing mucus droplets with Neisseria meningitidis in it. And then if you would inhale that mucus droplet, the bacteria would then get into your body through the respiratory system, eventually get into the blood, and then eventually into the nervous system. So it is usually transmitted through close contact with mucus droplets of individuals who naturally carry this bacterium. So if someone becomes infected with Neisseria meningitidis, it is going to get into the respiratory system first. From there, it will get into the blood and eventually jump the blood-brain barrier and get into the meninges, inducing inflammation. The patient will experience headache, stiff neck, sensitivity to light. Where it's also going to do some damage, though, is in the blood.